Bronchial asthma can be a very, very serious condition. It can also be very mild, it can be moderate, it can be severe. A lot of times when people think of asthma, they think of somebody fighting for air and turning blue and rushing to the emergency room. That's usually not the case. Usually asthma is easily controlled with medications. Let's talk about what's going on in the lungs with asthma. There's really two things that are going on. Number one, the airway goes into spasm. And when it goes into spasm, there are great medicines that we can use to relieve that. They would be albuterol. It's now Proventil, or ProAir, or MaxAir Autohaler. All of these are inhalers that we can use that open up the lungs. They begin to work in about 5 minutes. They're working at their maximum in 15 minutes, and they last 4 to 6 hours. So if somebody is having little bitty asthma attacks maybe once a month, maybe all they need is an inhaler. If you have exercise-induced asthma, you can use 2 puffs of your inhaler before you exercise, and you can exercise all you want, usually. Now, there's another thing beside bronchospasm going on in the lungs, and it's the most important, and it's the one that's most often neglected. On the inside lining of the lungs, there's frequently inflammation. Inflammation are cells that come in because of the allergic reaction, and they begin causing puffiness and swelling and narrowing and scarring of the basement membrane and actually causing death of some cells that are there. And it's low and smoldering where sometimes people don't recognize that's going on. Pulmonary function studies, lung studies will tell us if you have inflammation in the airway. Usually, if somebody's having asthma and is having to use their inhaler twice a week, then they have inflammation that's going on. Even though they feel wonderful, they feel fine, and they don't even know it, but that inflammation can be treated, and then, most likely, you won't even need to use your inhaler twice a week. Now, the inflammation is usually treated with 2 medications. Number one is inhaled steroids. I'll show you in another tape how to use your inhalers. But the inhaled steroids are essentially not absorbed, and so they're very safe for the person. So when you inhale an inhaled steroid, it calms down the inflammation. They're anti-inflammation. They take the inflammation away and the twitchiness of the lungs, and the lungs go into spasm goes away. It's your most important medicine. Those medicines have to be taken regular. It's like diabetes. You have to take your insulin every day. If you've got asthma, frequently you have to take an inhaled steroid every day. When you use your inhaled steroid, you need to rinse out the roof of your mouth so you won't get thrush. Discuss with your doctor if you're worried about inhaled steroid. If you're worried about that word steroid, discuss that with your doctor. He'll be able to explain it to you very, very easily. So, an inhaled steroid and a bronchodilator, and your asthma should be under great control. There's a second medicine that opens the lung and works against inflammation called Singulair. Sometimes we add Singulair on. Our purpose is to get you well, to get your asthma where you can perform a normal, active, rambunctious life with normal pulmonary function studies, do anything you want. You just have to take your medicines regular. Sounds pretty good, doesn't it? We'll discuss that later in my office.